Good morning, everyone, and welcome to today's webinar, Workplace Fertility Support, the First Step. We're really delighted you can join us today. And we're looking forward to having a really thorough and interesting discussion about how reproductive issues can affect the individual, how to find out who might be struggling with fertility issues in your workplace, and how to help encourage more disclosure and conversations around this at work. We're also going to be letting you know a little bit later on about some more upcoming webinars that we're getting in the diary to continue the conversation with you. And we'd love to make this a very interactive session. We'd love to hear from you, your experiences, how you are tackling this issue in your organisation. So there'll be a few polls and opportunities to share your views and ask questions all the way through. Just to introduce myself, so I'm Helen Bieden. I'm a writer, speaker and advisor on inclusive work cultures and professional careers. I used to be a director at City Parents and before that a management consultant. I'd also like to introduce my fellow panelists today. So Helen Burgess is an employment law partner at Shoesmiths. Bruce Eaton is an independent advisor, having gained over 25 years experience across private healthcare, benefits and insurance industries. And Hortense Thorpe is a procurement business partner, and she also founded the Fertility Group Network at Centrica, where she works. So we've got lots of personal experience across our panel of dealing with fertility issues and connecting with others in the workplace around this, and we're really looking forward to sharing both our personal and professional experiences with you as we go through the conversation for the next hour. So just to start us off, we'd love to hear what you would like to get out of this session today. What prompted you to dial in and join us this morning, and what's on your mind regarding this topic? So please do use the chat function, sharing it with everybody to let us know what would you like to achieve from this session today. And we'll maybe pause a little bit later on to just pick up any themes coming out of that. Just to get us started, we're going to run a quick poll just to see what people's understanding and knowledge around this topic is. So if I open up the first poll, you should see that coming up on your screen. And the question is, when you think of infertility, do you think of it as a disease? So if you could click on either yes or no, and we'll just give it a few seconds to let you all respond. And then we'll share the results. Okay, they're quite interesting seeing the numbers coming in. I'll just wait a few more seconds until the numbers slow down. Great. I think we're just about there. If you haven't voted yet and you want to, please do so now. Okay, so now I'm going to close the poll and we'll share the results. And you can see that 84% of us don't think of it as classified as a disease. That's really interesting. Well, the 16% of you that said yes are correct. It was classified as a disease by the World Health Organization in 2009. So that's a real learning for all of us already today. Okay, thanks for participating in that. Let's hear a little bit more from my fellow panelists, because I think it's really helpful to understand how an employee who's experiencing reproductive health challenges might feel and how they might be impacted in the workplace. I know all of you have had different experiences. Helen, could you tell us a little bit about your experience, please?
Yeah, of course. I'm the other Helen on the panel. My I suppose, process started in 2015. So I underwent IVF with my husband. we'd wanted a family, and I think it was in late 2012 we decided now was the right time, and unfortunately Mother Nature had other ideas, and we naively thought it would just happen, and 3 years later we found ourselves going through IVF. So that's 3 years of having to deal with it, both working full time, both having demanding jobs, and then having to embark on the IVF process, which, if any of you have undertaken it, it's physically, emotionally, mentally draining in all respects. And I think we didn't appreciate that, and I certainly underestimated how just involved it would be and how it would occupy, most of your waking hours sort of thinking about it and having to go through what you're going through. And I had the full-time job as well, which most people do have work to consider as well. But I was lucky in that my job as a solicitor, I was at the time, and still am, relatively senior, and I had a lot of autonomy in my workload, in when I could schedule things. So attending scans, appointments, procedures, because there are a lot of them involved when you're going through IVF, it was a bit easier for me to manage. But for those people who don't have that autonomy, really tricky, especially if they're trying to deal with it themselves and not particularly wanting to share with their employer. And with that autonomy, I still felt a lot of pressure to keep going at 110 miles an hour with my job, because that's what I did. We were career orientated before that, and I just thought I would continue. And I got quite far along in the IVF process, and I just felt like I couldn't do both. I was trying to do both so well, trying to do all the things you should do, relax and take it slowly and try not to think about it all the time, but it's inevitable. You're told not to think about an elephant, you think about an elephant. And I just found that I got to a point where I'd gone in for this particularly invasive procedure. I'd actually passed out, yet I still went into the office at lunchtime to host an HR director's lunch. And I, afterwards, what on earth was I doing? I was grey, I must have looked dreadful, and I should have asked a colleague to cover. And I think that's when it hit me. If I was sick, if there was something else, I would have just said, I'm really sorry, I can't do this. And I needed to take a step back, and I had a really good learning and development team, spoke to one of the coaches there, and it was a light bulb moment. She said, yes, you're not expected to have work as your focus all the time. It's okay to have a life and things outside of work. At the moment, your focus is on trying to have a family. And for me, that was just so welcomed and just gave me permission to think, well, actually, yes, I can focus on this. So at this stage in my life, I'm going to focus on trying to have a family. And I was so fortunate in that, because I know lots of people don't have that support from their employer. So that's a little bit of me in a nutshell.
Thank you, Helen. It's so true how just somebody else's perspective on what you're dealing with can just, help with the realization that you might need to shift your priorities a little bit and you'll look after yourself. Yeah. Bruce, would you like to tell us a bit about your experience?
Indeed. My experience is a number of years ago. It started about 13 years ago. And very similar to Helen, both my wife and myself were in full-time jobs. So I was in a reasonably senior position at the time. You suddenly embark on this mysterious journey that you don't want anyone to know about, and then suddenly it hits you, as it did with Helen, that you have to talk about it. I was in a senior role. I decided to share with my employer and my line manager, and I got support. Support as much as people can, because not everyone understands the journey. I remember sitting in a hospital car park and taking a phone call to talk about budgets halfway through, my wife about to going into a procedure, and it doesn't sort of run so well at that point. But I was incredibly lucky that my employer understood. They supported me, and I had the flexibility and autonomy around my role to be able to go and do things. But it still hangs there in the back of your mind, and the day you turn up to work when possibly you've had a failed cycle, you can't explain to people what is going on. Even if you've been open, you cannot do that. It's a bereavement. So you're carrying that into the workplace and trying to keep a face that everyone wants to see. But as I say, it was slightly lightened by the fact that I had shared with my employer what I was going through, but it wasn't everything, because back then, and even so now, I'm not sure it's exactly the most recognised journey that most people go on, and therefore I would encourage anyone to speak out as much as they can.
Yeah. It's so interesting to hear our different experiences, and that's something we'll keep coming back to and exploring during the conversation about what might feel right for you, and how people, you know, have different needs for privacy versus sharing, and the benefits of both, I guess. Hortense, tell us about your experiences.
Hi, well, my experience is probably like everybody else's, slightly similar yet very different. I actually focused my career on my career and traveling and doing what I like for a while until I actually got married and settled in. So in my late 30s, once we got married, we started trying, and that never worked. And so far, I've done 3 failed IVF cycles. The last one was just before lockdown. And so for me, it has been difficult in the way that I had to have multiple surgeries before even being able to try IVF. It was really painful as well as physically and mentally draining. And then on top of it, I've actually funded all 3 failed cycles myself. So it's also been financially a bit of a drain. And in terms of the work sort of experience, was I had a very, very supportive manager throughout the whole experience, and it was really, really helpful, and it removed a lot of the stress that I knew my manager actually trusted me to still do a good job, and not actually expect me to do 150%, you know, and she expected for me to focus on that, and it went really well in terms of the workplace and my career. I actually never performed better before. I even won awards whilst I was going through all those cycles, and the bereavement of every single failed moment when everything falls down and collapses, and you really need to just focus on yourself, because anything work-wise is you just can't think of it, and that's what's really difficult. I think as soon as you've got a supportive manager, that really helps a lot. It helps you focus on what you need to and relax into just knowing that, you know, you're trusted to continue your job as much as you can. And also, I think the fact that our organization has a lot of the flexible working in place and the technology for us to be able to work flexibly. So that meant that I could be in the clinic and still working. So I had set up my laptop in a little corner of the clinic under the stairs, and I could just work away whilst waiting for appointments, because sometimes they also get delayed. You can't really manage the timing of your appointments and all of that. So I think the key thing is, as for a flexible working situation with your manager, be open about it as much as you want, but at least that will help you manage your career as well.
Yeah, thank you, Hortense. You touched on a really important point there about how you can't control, you know, the many aspects of the process and experience that you can't control, from how long, you know, whether your appointment's going to run on time, to obviously, you know, the success and failure outcomes. So, and that can be something just in itself that can be very difficult to you know, to live with. Also wanted to introduce our 5th panelist, Hema Wara from Fertifa. She had a few little technical issues on joining at the start, but I'm hoping, Hema, you can hear us okay now.
I can, thank you.
Do you just want to introduce yourself briefly and tell us about your experiences?
Yes, so I'm Hema. I used to work in HR for sort of almost 18 years before I joined Fertifa, and I think the one thing that I wanted to share, I mean, I've been on this fertility journey myself with my husband for the last 10 years, and we're still on it. I'm currently in the middle of a frozen embryo transfer cycle as we speak. So it's been painstaking. I think for me, I had, you know, this is my 8th round of IVF. I've had 4 miscarriages. I actually left my job last year after going through some serious anxiety. I was getting panic attacks and depression, all as a result of my fertility situation, and just, I think I came to the realization that I couldn't work in a stressful job, in a really stressful environment, and handle the whole fertility situation at the same time. So I eventually left my job, and you know, I can't say I've ever looked back. I do miss the people that I worked with, but actually I'm now making a difference, and actually my focus is much more on the fertility world itself and helping other people. And I think it's changed me as a person as well. You know, the whole mental health situation, I think the link between that and fertility is so deep, and a lot of people may not realize that. And I think it's just something that we will pick up on in you know, future conversations and webinars as we go along. But I did want to share that piece.
Yeah, thank you. And it's really hopefully helpful for people to hear about all the different kinds of experiences, and that people are very much at different stages of their journey. Just to introduce my story very briefly, my husband and I started trying for a baby when I was 35, he was 44. I had 2 stepchildren from his first marriage. We expected it all to be plain sailing, and it was quite devastating when nothing happened and we needed to resort to IVF. We had to go privately because the NHS wouldn't fund us because of my stepchildren. The first effort resulted in failure, which was just incredibly hard to deal with, and then even harder felt like trying to have a second attempt, but for 6 months being told we couldn't start another cycle, and then being told that actually IVF was no longer an option, we'd have to consider surrogacy and adoption. And having never had any reproductive issues in any sense, you know, I was just astonished by that, and we decided to just ignore them and give it one last shot, and very fortunately that happened to work for us, and we have a 9-year-old daughter. So it was a huge roller coaster all the way through, and as a result something I feel very personally passionate about, helping to encourage more conversations about this in the workplace and helping others going through that journey too. Okay, so just moving on, we've had a couple of questions I know come in around using the chat functions or submitting a question. Just to clarify that, if you want to, obviously there should be a chat function where everyone can see your comments, or you can submit a question which just comes to us as the organisers and panellists. I think there's a little hand sign or a question mark sign that you should be able to click on, and that'll send your question over to us, and we'll pause regularly to just see what's coming in. Okay, so just as we're hearing from my fellow panelists, some of us didn't tell our employers about what we were going through, which is a very common occurrence. Helen Burgess, could you share a few thoughts on what prevents people from letting their employer know about their situation?
Yeah, of course. I mean, it's a myriad of reasons. Speaking, I suppose, personally, to put some of them into context, I went through I don't know the terminology, one cycle, but 2 attempts. So I had a fresh cycle, then a frozen cycle. So basically it's classed as 1 round. The first time, so when we went into it, I was very open. I told my team, my colleagues, some of the sort of senior colleagues in the firm, one who'd gone through it, and was very open, really sort of supportive, and was quite happy. It's then the flip side of that is then everybody knows every stage of everything that you're going through because you're very open. So there is no privacy, and that once you decide to disclose it, unless you change and say, well, actually, I'm going to keep some of this to myself, it then becomes very open. So some people may have an issue about confidentiality and may think, well, actually, I'm in the workplace. There's that iceberg model where they say, you know, you reveal about 10% of your personality to your work colleagues and you keep 90% of your values and moral compass, if you like, under the surface. And it's how far you shift that iceberg. So do you reveal more or less? And obviously, the more you bring to work of yourself, the better, because you can be open. But it is a bit of a dilemma because you're sharing a lot of very sensitive, and you know, I'm an employment lawyer, data protection, it's sensitive personal information, and it's, you know, you're sharing it and it could be talked about wider, not just among the people you're with. So that could be a reason why some people don't share. But for me, the downside to sharing was that when my first attempt was unsuccessful, because naively we thought it would succeed on the first go, even though the stats were there, we just blindly ignored them, and the success rate is quite low, so it's a high failure rate, as we all know. And when it didn't work, I then had to process that. My husband and I dealt with that. We grieved, we mourned, we thought, right, we've just got to get on with it, chin up. And then I thought, oh, I've told everyone at work. How am I going to then go in on Monday morning and relive all of this? Because you get your headspace in a place where you think, right, I can now function. Yes, it's awful, but we can, try and move on. And I thought, how am I going to tell my colleagues? Do I call a team meeting? Do I get everyone together? And no, that's not for me. That's not going to work. Do I talk to people individually? I have to relive it every single time and answer questions. And I thought, I don't want to do that. So I'm a keen cyclist, and I would often, before all of the IVF, I would cycle in to work, so a 30-mile round trip. And when I was going through all this, I took it easy, really stepped back and thought, well, they know I've stepped off the exercise treadmill. So if I cycle in, everyone will know. And sure enough, everyone then picked up, and I got some lovely emails of support. But one colleague just, saw me leaving the office, give me a hug and said, I'm here if you need me. And that was it for me. I went into the toilets and was sobbing and thought, oh, I didn't want to have to be there. But you have to process it, you have to go through it. So that made me decide on the second attempt, when we did the frozen cycle, not to tell people. I think I told one trusted colleague and nobody else, because I didn't want to have to relive it all. Some people may have experienced, well, I suppose some people may not work in a very open and inclusive environment. They may think, well, I don't want to tell colleagues. I might be, some people might judge me. Some people, I've heard anecdotally, some people, both male and female, having, unwanted jibes or jokes made at their expense. People might not want to risk that and disclose it. Some others may think, well, it might be a bit career limiting. I open and tell my manager I'm trying to have a family. It's a bit like the days have gone by when you used to have a manager interviewing a young female of a certain age, asking, when are you going to start a family? It's in line with that. Does that then subconsciously, consciously, openly, overtly, or just somewhere in the background, does that influence someone's decision whether to promote someone, whether they think they're committed and think, well, actually they've got competing priorities here, they're not focused on work? So people might not feel comfortable sharing it. And I think it goes back to what we've been saying before. And I think Bruce and Hortense and Helen, I think we all touched on it, having a supportive line manager, it definitely comes from the top, to know that it, not necessarily specifically on this issue, but just to know that you can talk to that person about anything. And go to them, and if you want to be open and share it, then that's that inclusive environment that you feel safe in sharing it. But I think the other thing I just wanted to touch on as well is, if you're going through IVF as a couple, I mean, some people do it as individuals, some people as couples, I think you have to talk to each other as well about how you're going to communicate that at work, because you could have one part of the couple who's very private, doesn't want to talk about it. The other half might be very open and want to tell colleagues and work colleagues, and that's fine. I think you've got to agree it, because I think there can be an issue if you work in the same organisation, but also if you have, friends and overlaps in colleagues. You just got to decide how best to deal with it as a collective, rather than having an individual standpoint. But I think your position may change, like mine did. I was very open and then I closed down a bit. So it just very much depends on your own situation and how you feel. I didn't know if anyone wanted to add anything to that.
Yeah, Bruce or Hortense or Hema?
I can comment on that as well. I was in the same boat as Helen, in the sense that I didn't tell my work colleagues or my managers or anyone at work, or even actually my family members and friends, about what I was going through until probably maybe about 3 or 4 years ago, I think. And suddenly I became braver, and I just realised that I couldn't go through it by myself anymore. And I needed the support, particularly off my manager, as I was taking time off work. And it wasn't just the odd day or two. I ended up taking a couple of weeks off work whilst I was going through the cycle, because it was so intense, with having to be at the clinic at 7:30 every morning, and then again sometimes at 11 o'clock for a second blood test and all sorts of things like that. I think that's when I realised that I just couldn't keep it to myself anymore, because I was just taking too much time out of work, and I needed that flexibility and that time off, and I needed people to understand that, you know, that time off might not just be 2 weeks in a year, it could be 2 lots of 2 weeks in a year if I was having, you know, back-to-back cycles or things like that as well. So it is such a big decision to make, to involve other people in that experience with you. But I think it did help for me. It really did help, because people do understand, even if they've not been through it themselves, they have a degree of empathy, which, you know, when you're going through something like that, you do need.
Yeah, that's very true, Hema. So it is a really personal thing, I think we're saying here, depending on where you work, how you feel about sharing personal information like that in your workplace, how your partner might feel, what your previous experiences have been. You know, there are lots of different possibilities. It's not just you have to tell everyone or you can't tell anyone. It's a whole spectrum, and you might want to be quite selective, and that's okay if that changes over time, depending on how, you know, your fertility journey progresses. Okay, we're going to just check in and see if anybody has any questions at this stage. If you do, please type them in and we'll pick them up a little bit later on as we go along. And then we're also just going to, yeah.
I think whilst we leave people to maybe type up the comments or questions, I also wanted to sort of bring in the element of the poll that we did at the very beginning in relation to what we were just discussing, because I think that's an interesting point, hopefully for our attendees, for our audience. The fact that actually infertility is a disability, it's a disease, as recognized by the World Health Organization, is a very important fact that is not known. And as a matter of example, I will share my experience, which is in my organization, we have an HR system where we can register a disability, so that there's a conversation with the manager to be had, and things put in place to enable the employee to bring their full self and be able to do as good a job as anyone in spite of that disability. And so what I do is influence everyone in my organization to register their infertility as a disability, because then it brings the data to HR's attention and enables us to sort of influence the organization to put in place the right policies. And so, for instance, we have 5 paid days of IVF leave, and that's really important that, you know, we make the most of it, that we influence people to take it if they need it, but also raise awareness that 5 days is nowhere near enough, because 5 days per year is less than even what is necessary sometimes for one cycle, and you could be taking several cycles of IVF treatment. And also, it's not necessarily IVF treatments, it should be fertility treatments kind of leave, so that it opens it up to other kind of treatments that help people grow families as well as careers. So I just wanted to bring that something for people to think, especially in the HR teams. Think about your policy and what that means for your employees, what they need out of it, depending on the setup around flexible working.
Yeah, that's really helpful. Thanks, Hortense. And do you hear people expressing concern about registering their infertility or their fertility challenges as a disability? Are people anxious about doing that?
I think people are anxious just talking about it in general in public, and knowing that their colleagues might know, you know, and it has to remain confidential. It has to be just between the manager and the employee, and even that sometimes is hard to take that step, because it makes you recognize that and it's just like any disability. Just saying you have one is a big step to take as an individual, to recognize that it is happening to you. That is really, really hard. So yes, but it's a question of raising awareness and making it normal, making it okay. You know, saying, you know, it's okay. We'll help you through it. You know, and offering the right level of care and confidentiality. for me, the main thing is really keep it flexible. You have to make it down to the individual what they need.
Yeah, thank you. And I'm sure people listening will find it really helpful to hear how supportive Centrica are and the practical support that they're offering to people through their policies, etc. Great. Well, let's move on and look at the next poll now. So I'm just bringing this up on screen. So the question is, what are the chances of conceiving each month for a mid-30s couple with normal functioning reproductive systems? Okay, so if you can take a moment to vote on that. So what are the chances of successfully conceiving for a healthy couple in their mid-30s with no reproductive issues? Okay, thank you. I can see the scores coming in. Just give 10 seconds or so for people to think about that and select the answer. Okay, we've had just about 2/3 vote, and I can still see some more votes coming in. So we'll give it a few more seconds. If you haven't voted yet, please do so now. Okay, great. Let's close the poll now, and I'll share the results. So you can see that just over half of today's webinar participants think there's a 20% chance of conceiving. About a third think there's a 30% chance, and 18% think there's a 10% chance. Well, actually, again, the 18%, you've got the right answer. There's just a 10% chance of conceiving each month. If we looked at the same question for a couple in their mid-20s, it's still only a 20 to 25% chance each month. So those numbers, those percentages are quite sobering, I find, for me. So it's really helpful to educate ourselves around, these probabilities and therefore how likely it is that people might be struggling to get pregnant and to successfully have a child. It's likely to be far more widespread than perhaps most of us are thinking. Okay, so just moving on, we're going to think a little bit about, from an employer perspective, how can employers know who might be facing such challenges within the workplace? And I was going to offer a few thoughts on this here, but colleagues on the panel do chip in as well. And I think I'd start off by saying it's not easy. It's a bit of a chicken and egg situation that as an employer you need to create an environment that feels supportive and encourages people to disclose, but equally, it is a very personal decision, and you have to respect obviously everyone's privacy and right to privacy, and recognize that not everyone will want to talk about it or disclose it in the workplace. If your organization's big enough and has some employee networks or employee resource groups, such as a family network or a wellbeing network, those are good places to chat to members and participate in the discussions and hear anecdotally if this topic is coming up and how people are talking about it and the extent to which people are choosing to disclose their own experiences. So connecting in with those groups is a great place to start. The other point that we've been making already in the conversation is that actually having a supportive line manager that you can talk to is incredibly helpful. So line managers hopefully would in many cases be aware if somebody in their team is needing some extra support in their home lives to become pregnant or to have a baby. So, finding ways to encourage line managers to just be listening out for this and noticing if they think anyone in their team might be struggling for any way. And on that point, so what are some of the small signs? Well, when I was going through IVF in my workplace several years ago, there were little things that actually I felt very strongly about, or I did differently, or I noticed colleagues doing differently. one of the real little telltale signs that is probably not obvious to someone who's not having to go through or seek any kind of reproductive or fertility support is that quite often when you're on IVF medication, you might need to take aspirin every day. And I had a colleague who had a pot of aspirin suddenly appear on their desk, and we got chatting, and she said, yeah, I'm going through IVF. And I said, well, my pot of aspirin's in my drawer, and I'm taking it every day too. And so that was a little way of building up my support network. And another friend also said, yeah, I've got pots of aspirin in my handbag. So you know, the little signs like that. Other signs might be people choosing to absent themselves from baby-related celebrations. So you know, just quietly leaving the room if there's kind of celebratory conversations happening, or not being around if somebody is bringing their new child into the office to meet colleagues. Also someone that's suddenly having slightly irregular hours, having to disappear for work calls, or sudden unforeseen absences or leaves for a day or longer from the workplace. Quite often with IVF, it's so unpredictable, the process, that you're not able to give advance notice of these things. And I really noticed that when I was going through it, having to suddenly be absent when there were key team meetings or project meetings happening. So those are little signs that you can just tune into and be aware of. And I think the other thing is if you know someone who is being quite open about or has chosen to talk to people about their fertility challenges, then it's quite likely that they will be having conversations with other people as well. Because I think once you start disclosing about this, and you're making it clear that you have some understanding and empathy, other people might naturally come to you in private and talk to you and say, I'm going through something similar. So obviously as an employer, you're not asking anybody to breach any confidences, but you can be mindful that if you want to sound people out generally about the extent to which this might be an issue or what kind of support might be helpful, start with someone that has chosen to talk about it a little bit openly, because they might be able to share anonymously some views from other colleagues and act as a bit of a filter in that way. And Hortense, I can see you nodding on that, because I think, you know, obviously you've probably had experience of this in leading your network. Did you want to add anything to that?
Yeah, well, so just for the audience, my purpose in life, my quest at the moment, is to raise awareness of infertility struggles and also increase the level of care available, not just for my organization, but through this workplace fertility community to the world. And so I've been super open since the beginning, and I've created a network within my organization, which isn't private, but it's a closed sort of environment. It's online, so people can join it and then ask questions, etc. A lot of the time, people actually just email me directly with a question, or because they want to remain anonymous, and there's no way to join the group without being seen. So it's really important that I'm here, and I feel that it's my duty to just take time to listen to people's stories and then analyze what's going on and play that back to our senior executives. And I'm on a quest to really flag what's going on in people's lives, what are the struggles, how can we support them, because it's really key that they understand exactly, just like any other disability or any other background and challenge that people are facing, you know, within the diversity and inclusive world. And it's really key that we are able to share the different gaps that people are facing at work, and how the employers can actually close those gaps, whether it's the flexible working or the relationship with their manager, etc. And so there's so many things that employers can do, and our network is trying to do that and offer the different options that we can really make the difference for employees. For example, creating a line manager toolkit, highlighting the type of things, all the things that you've said, Helen, around how they can find out, or how they can, you know, be supportive, and also let them be aware of all the policies and opportunity to support that is available for employees.
Yeah,
If I
great.
could just add into that, I think that's really good. Creating that's fantastic. That toolkit for me, I think all I would need is that network. That was for me, having someone to talk to. That was the first step, and that was really helpful. So if you do nothing, it's just opening the communication channels and enabling people to have that conversation. Because I found out afterwards, so many people had gone through it, but at the time you're going through it, you think you're alone. You think you're the only one, and you're not. And I think that's, as Hortense said, getting it out there, getting people talking about it is the first step.
Yeah,
and it's just incredible how many people do keep it just to themselves. Like, I have read so many heartbreaking stories of women that went through miscarriages without talking to anybody, and for 17 years, and then all of a sudden they share that story, decide to share it with me. Not just about those that are going through it at the time, but also about sharing your past experience, because that offers a kind of release or sort of closure for people, and it gives them the ability to help someone else and feel good about it, rather than all this negativity around the failures and the struggles and the pain and the hurt.
Yeah, it's so true. I think we've had a good question come in. Hema, would you like to share that with us?
Yes, so this was a question that came in a little bit earlier, and Helen Burgess, I'm going to direct it to you because I think you might be the most suitable to answer it. And it was a question about what Hortense had mentioned about, infertility being classed as a disease by the World Health Organization. So the question is, disease and disability, are they the same thing from an employment law point of view?
Do you know, I've been thinking about that as we've been on the call, because the definition of disability from an employment law perspective is very discrete. It's not even what you would think about in normal parlance, but amongst man on the street type of thing. So you have to have a physical or mental impairment, and that has to substantially affect your ability to carry out your normal day-to-day activities, and has to last for 12 months or more. To my knowledge, there haven't been any cases on it. I don't think. I think in some cases it might, in terms of because it's physical or mental, it could be either. But in terms of substantially affecting someone's ability to do normal day-to-day activities, it's probably not going to count as a disability for employment law purposes, unless somebody has, a debilitating condition and it affects their physically or mentally. So it's very much that you go back to first principles, depending on the person and how it affects them. But as a general, you can't say generally it is a disability, and I think more likely than not, it's not going to be for the majority of people.
Although you could argue that from some of our experiences, for me it was debilitating in the way that you're so focused on it. When you learn that you're infertile, that you're having to go through a different route to the natural conception. For me, it was really debilitating. I ended up being in meetings and just starting crying for no reason, even not prompted by any particular conversation.
And I think what it is, the actual disease might not be the disability, but it could lead to things that are disabilities. So depressions, anxieties, it could lead to, states that, that you don't have to have a label to be a disability. It just has to fulfill that definition. So you're right, Hortense, it could, depending on how you as you're going through it, it could impact you in that way.
And
really
I believe from what the Fertility Network, I think, research has shown, is that actually it can also lead to suicidal thoughts, for more than 40% of the people affected. So I think the mental health aspect is so key, and that support of the processing of what's happening to people is really important.
Yeah, and I've just seen that we've got one question comment around that about, how can employers help people who might be obviously working from home now, feeling like perhaps can't access the same kind of support that they might otherwise get from colleagues in the office. What can we do to put them in to help them where they are currently? I think we'll come back and answer that a little bit later, but there's another question as well that perhaps we can just ask you to clarify a little bit more about, Hortense, when you and Bruce say a little bit more shortly about what employers can do to help their employees, and that's just to share a little bit more detail about the 5 days leave policy that you have. I'm just curious to know a little bit more about the dynamics of that. But I'm just going to hand over now to Hema, who's going to guide us through the remaining 10-15 minutes of the webinar.
Okay, so I think we've talked a fair amount about mental health and how reproductive health is such a sensitive and private issue. Just like mental health was actually a few years ago. And just like mental health, a lot of employers are encouraging their employees to, try and how to support them and speak out a little bit about the situation. So I guess the question is, and Bruce, I'll direct this one to you first and foremost. How would an employer encourage their employees to talk about their reproductive health in the very first instance?
Well, thank you. I can speak about this from own experience. A few years ago, as the managing director of a small organisation of about 100 people, it was only by the fact that I'd been through the journey myself that I could, as been said earlier, Helen was mentioning about picking up the signs and signals from people in an organisation, is how can you set an environment that allows people to be comfortable with speaking about something that they may not want to talk about. The important thing is, first of all, however you can, this is not a career limiting condition. A lot of people get that into their head, that by being absent for long periods of time, by not performing, that this could become a career limiting issue. Well, if people are encouraged to talk out about it, that you minimise that. Now, we've heard from other panelists that sometimes you don't want to talk about it, but from my own experience in an organisation, when I would hear from my senior management team that someone in their team was going through a reproductive health issue or IVF, etc., I would say, well, let them talk about it. Let them have time off. Let them come to me if they want to. I had an open door policy, not necessarily was it going to be an influx of people coming to my office as the MD to talk about it, but I wanted people to understand that they could talk, and if I was available, therefore that should cascade down through the business. So my personal journey in that position was to create the environment that made it safe and effective for people to work through this. And to pick up on something earlier about signs, one of the telltale signs I found was people who've been absent for a while who were then suddenly looking for pay rises. We've talked about people funding IVF. It is a financially debilitating journey, and therefore, as an employer, it's not necessarily in your gift to fund, but you can support, review, possibly be a little bit more creative around that side of things, and without making any false promises, etc. So my message to everyone, it doesn't matter what size business you are, where you are in the evolution cycle of policies and procedures, is if you can keep your management team, senior management team and middle management team aware of what people go through, and sometimes just by introducing the topic, as we've discussed earlier, some people will come out of the woodwork and talk about their own journey that you never even realised about. You then start creating the environment in an organisation. And finally, we've mentioned mental health. Fertility, reproductive health is a mental health condition. It has impact. As we've all said earlier, miscarriages, failed cycles, etc. are bereavements. Many clinics do provide counselling to individuals going through the journey. Why is it any different? It's not. You do need to dig deep and find out about it. It is part of the mental health journey that lots of people are on, even if they're not talking about it. It's just how it provides tools within an organisation to allow people to speak up, even if it's in private to someone. So that was my personal experience. Obviously, I was slightly different in the fact that I'd been through it myself, but I would encourage anyone else to do that as a starting point as well.
Thanks, Bruce. And Hortense, I know you've spoken about, the network that you've set up within Centrica, which sounds amazing. We've got a few questions about that, actually. You mentioned not just about the network, but also about the leave. that people are enabled within Centrica. So some of the questions about that, it says, question for Hortense regarding 5 days leave for IVF. Do people in the organisation have to disclose, therefore, that the leave is for infertility treatment? How is the leave registered and who would get to know about it? Would it just be the line manager?
Yeah, absolutely. So it's just an option when you when you request a holiday on the system. It's just one of the drop downs. Just like you have paid vacation, you have paid IVF leave. And so the only person who would know is your manager. So it's a good thing to introduce it to them rather than just book it without having had that conversation. But it is on the system, it's registered, it's in the maternity policy as well. That there's a sort of, not really a rule, but more like some guidance around taking the leave. They ask for a bit of sort of warning to the manager and agreeing in advance the different times. The different need for the leave, although I have challenged that because, as you all know, sometimes you need an appointment the next day. You don't have any warning of when you will need to go out to have a procedure done when you're going through IVF. And also it shouldn't just be stating IVF, because you could be doing other things for which you need to take time off because it's during the day, etc., if your work isn't that flexible. So yeah, absolutely, this is something that has to remain just between the employee and manager, but has to be flexible enough for it to be used at all at the same time. But so the group that we've set up at Centrica is like a social platform. So we're using Microsoft Teams, but it could be a group on Yammer, and it's an open forum where people just join, and automatically I've set up sort of an automatism on the system to send them an email from me saying welcome, and also describing what they can expect from the group and the different resources available, all the different things that we've been doing, and a welcome video as well, so that for those that prefer interactions like this, they can also watch different videos of senior executives that have gone through this and are sponsoring the network, and other members, their stories, etc. But also what we've done through the group, the fertility, what I call the fertility group at Centrica, is offering a buddy system. And so when someone is saying, well, I'm going through adoption, do you have any help or any experience of it? Then we try and find someone else in the group that has gone through it already and that can support them. And then we sort of match them. I myself, when I went through my first IVF cycle, I was really struggling with the idea of having to inject myself by myself. And because I wasn't necessarily going to be with my husband and he might not be able to be there to do it for me. And so I found a buddy that really was hand-holding me throughout the whole time, was checking in on me, was even offering to come to appointments with me if I needed. And there are so many amazing people out there. There's like an untapped wealth of support within your own organization without having to use a provider. Already start using that, because people that have gone through it want to give back. Especially if they've been successful, they really want to support people, and so that system can work as well, really well. But the most important thing that for me I'm struggling with at the moment is the level of care that we don't have, basically, because this group is very informal, but it relies purely on me sort of running it, or a few individuals. And it doesn't offer the confidentiality that we talked about. So for those that really don't want to disclose it, but still need to have their questions answered, we can't really do that. It's really hard, and it relies purely on me being able to share those questions, etc. So I think you also need to find the right support or provider that can offer that confidentiality and the right level of care. For example, we have a mental health, provider, but it's not appropriate for infertility, unfortunately, because when I called to have counselling, I was referred to sort of couples therapy, which wasn't really appropriate. It's really a bereavement. We've talked about, you know, the whole process. We need to speak to people that have gone through it themselves and that can really offer the right level of support, and especially questions around treatments, how very specific. They need real consultants that know answers to that, and that's not available very freely. So it's really important to think about, okay, so what is the population within your employees? To start creating the right forums for people to start opening up about it, and then tap into the conversations to try and understand, okay, so what is the level of care that we can offer? Because what would employers rather do? Would you rather that your employees took 3 months off and went through mental health issues, or would you rather actually offer the right level of support so that they can go through it as smoothly as is possible, and actually give back so much more, because they'll be forever loyal to you in a way. I mean, I'm forever grateful for my managers for being so flexible and allowing me to do that whilst doing my job.
Thank you, Hortense. So we're coming towards the end of our session now. We've just got a couple of minutes. We've got one quick poll question. We've talked a lot about, you know, women and the experience of fertility, but it also impacts a lot of other people. So one of the poll questions is about exactly that. Helen, would you mind bringing that poll question up, please?
Sure, there we go.
So this question is, what proportion of reproductive health issues are linked to the male partner? So we've got 3 options, 15%, 30%, or 50%. What do you all think? We'll just give a couple of seconds whilst we run that poll.
Yep, people are just submitting their answers now.
Okay.
We've had just over half vote. The votes are still coming in. Great, so last chance to vote now. We'll be closing the poll in a couple of seconds. Okay, I'll close the poll now and share the results back. We can see the answers there,
Okay.
Hannah.
Brilliant. So 15%, 9% of you thought that it was 15% of male partners that had reproductive health issues out of the population, and it was a tie. 45% of you said 30%, 45% of you also said 50%. Well, 45% of you who said 30% are absolutely right. So of all cases where there are fertility issues, 30% are due to the male alone, and actually 50% of those cases are due to both the male and the female. So it's very high in terms of prevalence. I think we all see, you know, when we think of fertility, we always think of females, but actually there are a lot of other people impacted. And one of the questions that we've got is about exactly that. So we're going to quickly go to the Q&A now, because we've got quite a few questions that we would like to answer briefly. I know we're out of time, so if any of you can hang on just for a few extra minutes, that would be really helpful. If we don't get to some of these questions, we will respond to all of the questions with the recording, and everything will be sent out separately. So one of the questions that we've got is this. So what about people who need treatment without there being any infertility per se? So for example, solo women or same-sex couples? Anyone want to take that question?
Well, I'm happy to mention what we're doing with the fertility group. Is we're actually teaming up with other DNI, diversity and inclusion networks within the organization. For example, our LGBTQ+ community and network, and try and understand actually what their needs are. And we make it very open and also flag the challenges and the needs of the different population, including those that don't necessarily need a treatment but have to go through adoption or surrogacy and things like that. And it's really important to consider all aspects of what people need to do to have a family, but in general, rather than just talk purely about IVF. So it's not just about reproductive health issues, it's also about the different routes that people need to take to have a child. And I think it's really important to consider that. So I'll just close it at that, given that we're running out of time. But there's a lot longer conversation to have, and I think we can cover that in future webinars. Just like I'm really keen to explain to people how they can set up their network, and we can do maybe a webinar focused on that. So how do you create that forum that I mentioned that I've done for mine?
Yeah. I'd just chip in and add very briefly that another thing I've seen organisations do, employers do, is to explicitly encourage conversations around prospective parenthood. Often the focus in organisations is very much on current working parents and carers, and actually you can do some great, organise some great conversations for people very early in their careers or at different stages, and just talking about how is it possible to combine prospective parenthood, becoming a parent in the foreseeable future or the next few years, and your career here in this organisation. And that's a wonderful way to just open up a very general conversation and showcase lots of different colleagues who perhaps have very different circumstances, maybe same-sex couples, maybe single parents, may have gone through infertility challenges before they became a parent. And it's just a great way to just make it a very general conversation that anyone can participate in without any particular label being hung on them.
Thank you, Helen. So we are coming to the end. Unfortunately, we do have other questions, but I think what we'll do is we will answer them via email to all of the attendees today. I'd like to thank all the attendees and panelists today for your support and for your comments on the webinar. We are going to be holding future Workplace Fertility Community webinars, and we've got the next one actually, we'll share the date with you right now. So we've got National Fertility Awareness Week actually coming up at the very first week of November. So on the 2nd of November, which is a Monday, we will be holding our next webinar, which is about the first practical steps to bring reproductive health into the workplace. So today we've talked a lot about our individual experiences, how it feels to be going through fertility struggles. Next time we're going to be talking a little bit more about the practical steps as to how to introduce it within the workplace. So there are also other webinars coming up. We're doing a webinar on introducing a fertility network in the workplace, so Hortense will be leading on that one. Building a business case for reproductive health care generally within the workplace, which will be really interesting. And what does a good fertility policy look like? And actually, I think we'll add to that and talk about the prospective parenthood side of things as well. So we'll introduce a webinar for that too, because that's really key to ensure that, it includes all of those people, not just who are struggling with fertility issues per se. If anyone would like to join the Workplace Fertility Community, it's completely free to join. All you need to do is go on to the Fertifa website at www.fertifa.com, and then under the Employer tab, you'll select the Fertility Community option from the drop-down, and you'll see a Join Here button. So if you click on that, you will be asked to answer a few basic questions, and you will join the fertility community. Thank you, everyone. The recording of today's session will be available and sent to each attendee via email. Thank you again for your time and participation. Have a lovely day.
Thanks.
Thanks.
Bye.
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 Bye-bye.